This is Jeff LaBianco with Ask Dr. L Whole Personal Development. Now, I've had a lot of patients who actually have neck pain on both sides or even one side that starts to peripheralize, or basically the pain begins to move down the shoulder into the elbow all the way into the wrist, or it may go back into the shoulder blade. It may even come into the chest area. And a lot of times patients are wondering, why is that happening? You know, is it my shoulder that's causing the pain, or my elbow, or is it my neck? Well, 9 times out of 10, it's your neck. And of course, we need to assess this to be sure. But once we assess it, we determine that it's neck pain because what happens is, let's take this side for example. Muscles within the neck, or even the mid and upper back, okay, the cervical area, they begin to tighten. The muscle fibers tighten, and those fibers begin to push on the nerves, sending nerve pain down the arm. Now, it could be tight muscles doing this. It could be a disc bulging, pushing onto a nerve. Like I said, it could be on one side, it could be on both sides. It could be peripheralizing down, around, or in the back. And basically what you want to do with this is home exercise. By consistently loosening up your neck, putting yourself in a proper posture, reducing that tightness within the spine, and pushing that disc bulge back in the proper position, you're going to reduce your peripheralization. And when you know you're doing it right, you'll notice that the pain that was once in your wrist or your elbow, it begins to travel upwards and centralize into the neck. Now, picture a jelly donut. You have the jelly in the center. Let's say my fingers are the front of your neck, okay? If I were to squeeze like this and push the donut in the front, the jelly would shoot backwards. If I were to squeeze or push back, the jelly would move frontwards. And that's similar to what's happening with your discs. When you go this way, when we push forward, it's similar to having your neck move forward. So we're pushing the disc space back, and that's pushing onto a nerve, sending pain down both arms. If you were to only have pain on one side, that would mean you have your jelly donut, here, let me show you this view. You're pushing forwards, but on an angle. And that is then bringing the jelly to one side. For example, I'm forward and maybe tilted a bit. So by doing this, I'm closing down this area, pushing this space this way, sending nerve pain down that way. So let's get to the treatment part, okay? What you want to do to reduce peripheralization down both arms is you first want to push that disc space back. So we do something called a chin tuck. That's the movement. You don't want to go down, because what's that going to do? That's going to push the disc back. You don't want to go this way, although that may help sometimes, but we'll focus on the chin tuck. We want to push back, just like opening a drawer. You can even use your hand to assist. That will get you to a good posture. It'll keep everything in alignment, and it'll allow you to move on to the next exercise with proper form, which are the shoulder shrugs. And to do a backward shoulder shrug, let me show you a side view. You come up and back, okay? If I were to go up and forward, what's happening? It's pushing me into a poor posture. It's pushing that disc space back, and it's bringing the peripheralization down. We want to do up and back. We want to do backward shoulder shrugs to get into good posture. Open up the chest and bring yourself into alignment, okay? Next one, shoulder blade squeezes or scap squeezes. So you squeeze the shoulder blades together. See if I could show you this view. as if you're cracking a walnut in between your shoulder blades. Now, those are great exercises to get yourself into a good posture and to help that peripheralization down both arms. Now, if you only have the peripheralization down one arm, then we need to close down that side to bring the disc space back in a proper position. So I have peripheralization down this arm, let's say. What I'm going to do is a chin tuck. So tuck the chin, and then we're going to go this way. Why? Because we're pushing now the disc space back towards the center, relieving this discomfort. Okay, I'll show you that one more time. Chin tuck. I can even do this, chin tuck, and then even bring your arm and assist, side bend. Chin tuck, side bend. And you want to perform that multiple times. It's repetition reaps reward. Do it once or twice, nothing's gonna happen, but do it 20 to 30 times. You should notice a difference. You'll notice the pain centralizing. If you don't give up, okay? How long did it take for you to get this discomfort? All right, how many hours or days are you in a poor posture that you haven't even realized that causes this pain? So we need to give it time, okay? Give it about a week. Do this exercise multiple times throughout the day, every hour if needed, okay? You'll notice it getting better. And for some reason, if it gets worse, then stop. Now this is important. Once you've centralized the pain or brought the pain from the elbow to the shoulder into the neck, and you only feel it in the neck now, you want to perform the exercises that abolish the neck pain, or basically get rid of it for good. And these are, going back real quick, they would be the chin tucks. They would be the backward shoulder shrugs, as well as the shoulder blade squeezes. Keeping a good posture. Doing those daily, repetitiously, every hour on the hour, 30 times, you'll notice a difference. But that's how you improve this discomfort, this one-sided peripheralization that stems from the neck and goes in all different areas. I hope you enjoyed this video. I hope it helped. Please comment below if this has helped you. And if you have any questions, please post and I will answer for you. Okay? Have a great day, and I'll see you in the next one.